How you doing, guys? So this is Dr. Specific Chiropractic. In this video, we're going to talk about shoulder pain, okay, and how we address that. Other things we're also going to address is you talked about your right knee pain, okay, right Achilles pain, and also let's show the viewers that fun injury we got over there. There's one heck of a bruise, okay, on that fourth ring finger over there, okay. So let's start from the very top for the first one. So, close to the viewers, what happened to that right shoulder itself?
Yeah, so a few months ago, doing jitsu, and I don't know if it's wear and tear, but eventually it started hurting, sort of in the top of the shoulder, in the front of the shoulder, and it radiates down into my bicep. Mm-hmm. Hurts when I curl, it hurts when I sort of use my shoulder, any upward motion with my arm. Mm-hmm. But yeah, so that's the main thing that's bothering me.
Okay. And all right, what's going on with the right knee?
The right knee hurts when I walk upstairs. It hurts sometimes when I go downstairs, not all the time, but every time I go running, it hurts after maybe 5 or 10 minutes of running. It's just sort of every step is just pain, pain, pain.
Gotcha, good. And also, what's going on with the right Achilles?
So the right Achilles is like, it's not painful, it's more like a tightness that I've never experienced before, that just started recently, in the past like 6 months or so. And it just feels tight when I run, like, not painful, it's just like, feels like something's like constricting almost, like it's just bothersome.
Gotcha. And show to the fun part, how did you bang out that ring finger there?
Again, jiu-jitsu, got it stuck in somebody's gi and they twisted the wrong way, and then it's been hurting ever since. So that was about a month ago.
Yeah, we could see it, it's definitely looks twisted up in it.
Yeah.
Okay, so there are some key component areas where we're talking about in terms of, we're going down your history. You're saying, okay, I got some pain around that AC joint area, and you're trying to do hammer curls and bicep curls, and where do you feel the pain when you do that?
In the bicep right here.
Okay. All right, so in this region over here, okay, that's typically deals with the 5th and 6th cervical nerve root. And over here is dealing with, but you don't feel any pain here.
No, nothing on my forearm at all.
Okay, so this one over here, okay, this is usually 5th cervical nerve root. So the fact that you're complaining a little higher up in the bicep itself, okay, I want to take a little closer look what's going on here. Because that fellow over there, that's what innervates from here, going down here into the elbow, hands, and so on and so forth. Okay. Now in terms of, okay, now we got right knee pain, Achilles. Okay. Now whenever I hear an Achilles type of pain, especially Achilles tightness, all right, that's dealing with the sacral nerves. All right. So therefore, I'm going to investigate what's going on with this region over here. Right? Usually it's number 2 and 3 sacral nerves that go straight down to this region over here. But the fact that you also talk about, you try to jog or run after just a few minutes, not even doing like even half a mile, you feel a lot of knee pain. And where do you feel that knee pain? Is it on the inside knee, on the outside?
Outside.
Outside. So the more lateral side, so we're going to take a look, see what's going on here. Either it's going to be the knee or it's going to be the fibula head itself. But if that sacral nerve is compromised, that nerve also goes to the fibula, all right? So I would definitely want to take a look at what's going on here. Another potential candidate is here. The 4th lumbar nerve goes to the entire knee itself. So this is also a potential we also have to rule out. So if the foundation itself is unstable, it may destabilize everything else above it, but more importantly, number 4th lumbar itself. So we'll take a closer look on the x-ray and also on you during the exam, see which ones do we really need to address to tackle with that right knee and also that Achilles as well. So now let's start connecting the dots over here. So we're talking about bicep pain right there, okay, AC joint pain, right? So now I'm taking a look at your alignment over here, the AC joint itself, yeah, it's like very slight, but we're talking like 1 millimeter misalignment. So we'll take a look at that one. The scapula is rotated a bit. We'll take a look at that one as well. But more importantly, I want to take a look over here. And what I'm seeing over here is that, yeah, you got an osteophyte going right in here, the sixth cervical disc itself is swollen. Okay? We even see it bulging out right over here as well. So why is that important? Well, we have this liquid ball bearing. It has to be smack dead in the middle, all right? And the nerve, it's this big, all right? And it needs to come out of that tunnel. However, if you have some kind of trauma to the neck, it comes out like this, what's gonna happen to it? It's gonna pinch a nerve, all right? And we start losing nerve function to whatever it's connected to. In your case, the bicep itself, all right? So we'll take a look, investigate on you, what's going on with that fella, right? And then when we start tracing down, says, okay, that's one aspect of it, but we also have to take a look at the entire skyscraper. We keep on tracing down where all the potential problems, but we already see we might rotate this way, rotate this way, rotate this way, rotate this way. So we keep on tracing down. What do we got? Okay, why do we have compression fractures here? This is crushed, really crushed, and crushed over here. So it looks like you have some kind of trauma in the past, really intense, where either you landed very hard or some kind of accident, what have you, and it squished this vertebrae, because this is supposed to be inflated like this. See how tall that is?
Yeah.
See how much this one? This is pancaked. Okay. So in addition to, it's also tilted on there as well. So I'm going to investigate on you how the nerves to adrenal glands are functioning on you. And biomechanically, it can also help explain the instability you got over here. And in addition to these, since it's coming to your ribs, it also may impact how the shoulder blade, the scapula, is gliding on these ribs, because the ribs, just like this, is supposed to be nice and smooth. So it's supposed to glide like this. But if, let's say, it's like this, what's going to happen? The shoulder blade is going to be like a speed bump. Okay? So it's not going to glide too well. And that's where it's going to impact the biomechanics of how your shoulders are moved forward, so like forward, backwards, abduction, adduction, all that stuff over there. Okay, so it's very key important to make sure the ribs, make sure there's no misalignment like this, speed bumps over here. Get a proper alignment, then it's okay. It glides very smooth and will move and pivot out all the directions itself. So, however, I'm seeing, we got some of these ribs over here, they're compromised because it's supposed to be symmetrical, okay, but they're not. Okay, you can see this one. This is more obvious to see. This is much more taller, and this is shorter over here. See, tall, short, and this is decently symmetrical here. See, it's alternating again. Short, tall, same, short, tall. So that's where all these little biomechanical issues, all because of that crushed vertebrae over there, that's starting the domino effect. Okay. Then we keep on tracing it even lower. And I want to see where how these nucleus pulposus are behaving. And yeah, we got this one, fourth lumbar, that's swollen over there. And then we trace it even further down. See that tunnel? See, tunnel's big, see, getting smaller and really small on that fifth lumbar. So we got two candidates over here. I gotta examine on you, see what's going on with that fella. But I do see a posterior open gap like this, a V shape, right there on that second sacral segment. So as we mentioned before on the neurology aspect, that's going to impact your outside of your knee, the fibula, and also that Achilles over here. So we're going to investigate on your examination if that's something we need to address. But on top of all that, we also got this pelvis over here, the foundation. Why is the whole entire foundation sitting on this way? Well, then I got to take a look what's going on with this right hip itself. Because this right hip, it's interesting that you're curving over, externally rotated on the left-hand side, and yet I do see slight little degeneration on the right-hand side over here. So biomechanically, they're connected over here. The reason why is because if you're rotated like this, your whole entire body has no choice but to try to rotate this way. So you're always constantly moving on this right side over here, it's going to wear it out, okay? But it's not too severely degenerate over here, so it tells me that this external rotation misalignment is more recent. So then we're dealing with anterior and posterior tilt of the pelvis itself. There's never be moving like this way, but no. Now we got this one that's compromised. So I wouldn't be surprised that we have a PI misalignment that's explaining some of this drop on that right side. So I'm going to take a look at that one, and also biomechanically to help with this sacrum over here, because I want to see the sacrum ideally like this angle here, not forward over here. So in essence, your foundation itself, it's making you tilt this way. And you're not going to walk this way. So therefore, what your body starts doing is compensating and trying to go like this. You're arcing your back like this. So that's when we start to see this arc a little more. And if we do a gravity plumb line over here, okay, from the 12, drop all straight down, normal should be here. So it's already telling me your back is like arcing backwards like this. And since you're arcing backwards like this, okay, your head is walking this way. So, but because we want the two gyroscopes to level out your head, center and level it this way, what can I do? Since I hold that back, since this bottom part is going like this, forcing the bottom part to go way back this way, your mid back have no choice, go like this. So that's when we see this huge arc in your mid back. That's further causing the shoulder around like this way over here, compromising and adding more stress and biomechanical issues to the shoulder themselves. So, wrapping all things up, yeah, we gotta stabilize the foundation itself. The 2S, if we do address that one, adjust it today, I'm gonna let you know, it is gonna tilt the sacrum forward, so there's gonna be more this way. That may not be fun, so when your body's ready for it, then we'll adjust this one to bring it a little more upright, take more pressure off the shoulder itself. But we cannot do both at the same time. It's going to be one or the other. So during examination, we'll make that determination which one we really need to address on today's visit. This right hip or that second sacral segment, right? And that's what's going to be the key. The long-term solution is this right hip to try to change the gravity line for this one and offload a lot of biomechanics off your mid-back to help you with the shoulders and so on and so forth. So the next step what we're going to do is we're going to do visualization, okay? And that involves, okay, let's take a look. Because when tissues gets damaged, it wants to start stabilizing because the biomechanics, it should be in ideal, optimal alignment. But when it doesn't, then the body says, okay, if there's something misaligned over here, in other words, if the head's going this way, shouldn't the muscles on the right side spasm and say, okay, let's pull the head back into proper alignment. So we're looking for those type of muscle spasms like that. You try to pull, so on and so forth, over here, and check everything else. In addition to also for swelling, okay? So, here, see it's puffy, swollen right there, the second dorsal level. I'm gonna mark that spot right there. Here, see it sinks right there, there's a sixth dorsal right there. Yeah, it's not too bad. So it seems like this compression fractures, you had multiple ones, it's chronic, it's been there for a while, it happened a while ago because it's very small puffiness there, it's not too much. So usually when a chronic injury, long standing, that's been there for many, many years, there's not going to be much edema and it's going to be very hard to find. Like this one, it's barely palpable right there, I could barely feel it. Okay, we got something over here that feels like that fourth right there. Okay, there's 2S. We got something like that swollen a bit. And then we're checking for edema, swelling. Okay, so we got some swelling on the right hip, SI joint over here. And same thing with that 2S over here. There's a swelling on there too. The neck, oh, I was just pointing out to the viewers over here. Okay, so this is very muscle tight on the right hand side. There's quite a bit of swelling right there at the base of his neck. This device over here is checking for signs of potential inflammation. And this helps us isolate and identify any potential spot that warrants a closer investigation to take a look, see what's going on, and make sure that these are the fellas that we will need to address on you. That felt really small. Left hip is moving fine. Yep. Right hip is jammed a bit. How's that feel right there?
Hurts.
Yeah, 2S. How's this feel over here?
That feels fine.
Not too bad?
Nope.
No. Okay, so there you go. There's our candidate, fellas. How's this fella right there?
That one hurts a little bit too.
Fourth lumbar. Ooh, Millie. How's that fella?
That one's tender, yeah.
This is not great. It's very inferior, that one. So that's going to really impact the biomechanics. Everything was above it. How's that fella right there?
That one feels fine.
Yeah, but it's not moving too well. It's also inferior. And that fella right there too, huh?
Yeah, that one feels fine to me too.
So you got the swelling right there. Feel that knot?
Yeah.
Yeah. How's that fella right there?
That hurts.
Yeah, 6 cervical, 5 is fine. Go ahead, do that bicep or hammer curl, either one.
That hurts.
Point to the viewers where.
All right near.
Okay,
Really
so I'm going to show you guys a neat trick, all right? So we're going to take some pressure off that nerve. Okay, go ahead. Now try it.
It's much less painful.
How much less painful?
Probably 50%.
50%.
Yeah.
Pretty cool, huh?
Yeah.
Okay, you go back down. Now the reason why that works, okay, and I'll show it to you viewers as well over here. Okay, this nerve, it got to come out of that tunnel. Okay. Now, as I show you viewers and yourself as well, on the X-ray, you're already like this. Okay, tunnel collapse, the nerve's being pinched. All I did was I put a little pressure off. As in, I pushed this vertebrae a little forward, open up that tunnel just a bit. That's where it says, hey, wow, I could do that curl. And it's like, it's less, okay? It's not magic. This is all biomechanics, okay, and all science. So now we confirmed it on you. It's definitely that 6th cervical nerve root that's in trouble, okay? So therefore, let's go ahead, let's get to work. Just all this stuff here. Let it drop a little more and tell me what's different.
Feels like looser, lighter in my spine. That was really deep.
Oh, so that was deep.
Yeah.
Any difference you notice in that right knee or the Achilles?
Yeah, they feel good right now. Both of them, the Achilles and the knee both.
You were saying that felt tightness in the right Achilles. How's that feel now?
No, it feels okay. Yeah, the Achilles feels good, the knee feels good.
Even the knee feels good. Huh?
Yeah, right now the knee feels fine, yeah.
Yeah, see, that's what I was talking about. Is that sacral nerve is going to that knee. Okay, let's take a look, see what else is going on. Okay. Right there and good. Drop the belly. Here it is, right. Okay, a little more in. Try your shoulders now. How's the shoulders?
Oh wow. Oh, the shoulder feels a lot better actually.
See, you feel that little bump there?
Yep.
Okay, so this rib, that's what's blocking off this shoulder blade here. So even though we set that 6th dorsal, this rib needs to be a little set, just like that. Checking the ribs on your right side. See, you're right, it went in just fine. So it's just this left rib right there. Now let's check, see how your scapula is gliding now. See, it's a little bit stuck. See, it's a little bit stuck right there. There it is, that's jammed. Oh, that's sticking like a sore thumb. Let's set this fella, we'll pump it up. Set it real, right there. Okay, come on up. Now I'll try the shoulders.
Oh yeah. That's so much better. Yeah, that feels a lot better.
Nice. Just like that. Alright, so this nerve goes through the shoulder, the AC joint, and the scapula. Set this fella right. Right there. Okay. Now give it a try.
Yeah, that feels even better. That's amazing.
So, tell us a number.
Yeah, from when I first got here, it's probably 80%. I can still feel something, but it's so much better. Like, I'm amazed. Yeah,
How much better would you say with that bicep right now?
It's probably 80%, 85%.
Usually when I hear there's an immediate knee pain from running, that's usually a fibula problem, right? Unless you really banged your meniscus. And right now when I'm testing over here, no, it's actually, the knee itself is fine. Okay, tibia and the femur is fine, but the fibula head, see this fibula, it's not moving. This is jammed. It's completely locked up still. There's a little more movement, but it's still locked. Then we check the distal end. See, this is also locked too. Oh, this is very swollen here. Okay, not too bad. See, I could pivot and move. See, and this fibula head's moving. See, this is locked. It's not moving at all. Distal. See, this is also locked here too. So I'm going to set both ends. There's just not enough sacral nerve function to this knee. Here's one. I'm going to pump this up a bit before we set this fibula head as well. There we go. There's the other one. Test that knee. See, I like it.
Yeah, no, it feels good. It feels like looser again. Like I feel stuck.
Okay, let's show to the viewers a close-up with this thing. Look at that poor fella. So that thing's been swollen for the past month.
Yeah.
Okay. So this is what I'm seeing here on the X-ray over here. Okay. Now in relation to all these other bones, and this bone over here, it rotated this way. This one rotated that way. This little tip over here also rotated this way. So since we're dealing with just the dip, okay, that's a distal interphalangeal joint over here, and this is what we're really going to take care of. But it looks like as you were pulling on that guy's gi over there and you rolled it, so yeah, it looks like you kind of strained his ligament here. Oh, see this? So now here's the thing, okay? Some other folks will try to just yank on it or traction on it. That's not the correct way how to address these fellows. See, it's all about supination and pronation. See what's over here? You can't supinate and pronate too well, especially going this direction. It's completely stuck. We check this one, the middle one, decent. See, the proximal one, see, it's moving just fine. This one got some fixation. So we're gonna set that one too. But this one, this dip, see that? There's almost no motion there whatsoever. So since it's not moving this way, that's why we're gonna rotate this way. But at the same time, we're gonna bend it this way. See, you have trouble flexing this joint over here too. See, this is decent, not great. But we see at the MCP, no problem at the MCP itself. But here, see that? You still have slight fixation in there. But this one is almost nothing. So let's, okay, we're gonna make this tight. Let's get a good grip on this fingertip. I'm going to pump it a little bit before we set it.
Oh, that's painful.
Yeah, I did tell you, that's why I have to pump it up. But go ahead, try that fingertip.
Oh yeah, it's bending better. It was only, it was stuck there this morning.
Mm-hmm.
Oh, that's nice. Yeah.
Yeah, that's one heck of a crazy sprain you got there. Be careful with that jujitsu. Here, see? Now this middle one, the pip, we have to take it to the pip now. Okay. Don't worry, we're not going to adjust this one. But yeah, you bang that one the opposite direction. Okay, now lean back a little bit. There we go. There's out the piece. Okay. Now I'll try it.
Yeah, it's moving much better. It still hurts, but it's definitely moving better than it was.
So how's it going? So it's been a week. Give us updates. How's everything coming along?
Knee felt great. Went for a run. No problems at all there. No pain, which is nice. Achilles felt good too. The shoulder felt good for a day or two, but then the pain came back, and same with the bicep, sort of radiating down. And then the finger feels like it's getting better. I have more, like I can move it more. Not quite as painful. Still a little swollen, but yeah, that's it. That's feeling better.
Right now, that's great results right there. So in terms of this neck over here, just like we discussed earlier over there on the previous film, okay, because of the pelvis and everything else is not fully stabilized, and so this one over here is not holding. That's why it's key to start stabilizing and rebuilding the entire spine to make sure that fella stays pressure off that nerve. So we'll keep working at it and get that strength back in there. Right. It'll take time, but we'll get you there.
Sounds good.
All right, thanks for the updates.